And that brings me to the most important point here. All of the data I've shown you is very supportive of the idea of reduction in dose intensity. And it supports all of the ongoing studies. But we need to acknowledge that no one has yet proven that we can de-intensify therapy in the HPV positive patient. And all of our guidelines appropriately state that the standard of care is to not de-intensify at all. And so for the patient whose values are oriented towards the most aggressive possible therapy, or whose values are oriented towards the most standard therapy, the answer remains that that is 70 gray of radiotherapy with high dose cisplatin. That said, I'd like to not completely hide behind that. And I will confess publicly that for patients who are not trial eligible or don't have a trial eligible available to them for de-intensification, we do at least talk to patients at my institution about to our low risk HPV positive patients about treatment de-intensification. But I think it's very important that when this is considered, that the practitioner needs to be extremely direct that that is not standard of care. It may have some data to support it, but it is not the standard. We need studies to get there. The other point I'd like to make is when considering stage for considering who's low risk, that stage needs to, you need to use the staging system in use at the time of a trial. So what you can't do, well, let me back up and say that our new staging system, AJCC version 8, includes not only the anatomy of the tumor, how big the primary is, what it's invading, the number of lymph nodes, and whether there's distant spread, but incorporates biology, which is to say HPV positivity or not. And for HPV-driven tumors, a lot of what was stage 3 and 4, our advanced stages, has now been decreased to stage 1 or 2, and some 4s have become 3s. That doesn't mean that you can look to the treatment of stage 1 and 2 from studies that were done in the era of AJCC7 and think that that's a comfortable thing to do. You have to apply the staging system in use at the time, the one that was used in the study. All that staging does for you is give prognosis. They've always been oriented around prognosis. And so if your question is, what is my prognosis? Then that 1, 2, 3, or 4 is better on AJCC 8 than on version 7. But if you're looking for cut points for where what the right thing to do is, then you absolutely must use the system in use at the time of the study that's guiding care, and that's mostly AJCC 7. With that, I will thank you for your kind attention, and I'm happy on the GRACE forums to answer any questions you may have about HPV treatment de-intensification.